left a couple of years ago to start Healthy Circles, and he's going to show us exactly what Healthy Circles does right now.
Thank you very much. So, good morning, everybody. We built Healthy Circles. I'm a heart surgeon, and as a clinician, it's always been a conundrum of how to deliver better care to vastly more patients at a fraction of the cost. Not just lowering cost, but how are we going to flip the cost curve upside down and be able to leverage technology to be able to better manage patients. And frankly, clinicians just don't have the tools in order to do that. So we built a de novo integrated care delivery platform that's designed and equally balanced between a tool set on the patient side or the consumer, because patients also include family members and friends and things like that, as well as healthcare professionals. And when we refer to healthcare professionals, guys like me with MDs after our name, it turns out, aren't the only ones taking care of patients. And people like nurse case managers and specialty pharmacy organizations, home infusion, physical therapists, dietitians, they have virtually nothing in order to be able to interact with patients and deliver care out in the community. So Healthy Circles is essentially three things that seem to connect with people and helping explain what we do. It has an interoperable invitation system with granular permissions that allow for the sharing of records between any and every healthcare professional and patient and their family. So it's essentially a Facebook for healthcare kind of experience. We also built out a tool set. Okay. We also built out a tool set analogous to SurveyMonkey for healthcare that allows clinicians to be able to author, without a computer programmer, their own health management programs and guidelines with branching tree logic and sorry, here I gotta enter the password. Branching tree logic, alerts and notifications, because as clinicians, you don't want to actually be looking at all of this data coming in from patients and labs and so forth. You're not going to have the time nor the resources to do that. So you need an exception management system, and that's really the keys to the kingdom to be able to deliver better care to a lot more patients, because then you can deliver health management and disease management programs to lots and lots of people, have the data come in, let technology do the heavy lifting, and then show you who needs attention versus who doesn't. So very quickly here, as an example, a case example of Julie Consumer. This is her patient portal. This is a record that could be shared to her from any clinician, and it's an aggregate record, so this is a common data repository. But what you'll see is Julie is enrolled in a number of interactive health monitoring and coaching programs, and so we'll just show you a session for her diabetes management here very quickly. And it can interact with the patient on multiple platforms. So we're platform agnostic. This can be done on our home computer, on an iPad, iPhone, Android. It's essentially agnostic to the hardware piece. We give that authoring tool the ability to integrate practice guidelines, feedback and guidance, immediate educational programming and videos. And then this information actually flows back into a shared record and professional portal where, we'll show you in a moment, clinicians can take the data amongst the data flowing in from dozens or hundreds or even thousands of other patients and be able to see exactly who needs attention versus who doesn't. And that's really, empowering for care integration, transitions of care, and the ability to expand the practice outside of an encounter-based fee-for-service model to what you're going to see is contributions to care and care integration in the marketplace. Just last.
You have like 3 seconds to just refresh my report.
All right.
So dive in very quickly.
Here we go, last 30 seconds. And so now we've logged in on the healthcare professional side. What you just saw the patient engage in now comes up on a dashboard. You're able to see all the patients in the practice or in the home infusion services or specialty pharmacy, all in the same place, be able to sort red, yellow, green, who's got symptoms and vital signs, double click on that, and be able to see exactly what questions were asked, what the answers were, red, yellow, green, who needs attention and who doesn't. Thank you.
Great stuff.
Nice.
You logged in? Yep. Excellent. So let me give you a quick intro to Vital. Steve